My name is Darlene Ertha. I'm a naturopathic physician with a practice in Ipswich, Massachusetts. I have a purpose, and that is to prevent people from having ill effects or death from using prescription drugs. Prescription drugs that are approved by the FDA. In 2010, there were 82,750 deaths in the United States from prescription drugs. Wouldn't it be nice if we could treat pain without that? Well, guess what? There is a way. I use several modalities. I use traditional Chinese medicine, using the acupuncture points that have been used for 6,000 years. I use electrical stim. I use pulse electromagnetic field therapy. As we know, we always walk around in a magnetic field on Earth. That can be interfered with when we have illness and trauma. I do manual manipulation, gentle manipulation, and craniosacral therapy. Combining all of these things, I have treated with great success people who have chronic pain, people who have chronic illnesses such as Parkinson's, post-polio, and many other things. I'm Dr. Ertha, and I had some life-changing experiences. One of them was in 1989, I had a severe spinal injury. And the first thing that the medical doctor did was give me a, quote, muscle relaxer. It was called Flexeril. And it put me in a semi-comatose situation for about 3 weeks. I was home alone. I had to navigate stairs. I woke up at odd times, like 4 in the morning, 2 in the afternoon, to eat and take care of my animals. I was never fully alert. It seemed to me like it was a very dangerous situation. I could have fallen, I could have overdosed. I lived alone in the country. And when the pain medication wore off, the pain was still there, and the injury had not been addressed. After several surgical procedures and 2 years of physical therapy, I was bedridden. I couldn't turn my head or raise my arms. Is there something wrong with this picture? Someone told me to see an osteopath he practiced his own unique medicine. He also knew Ayurvedic medicine, homeopathic medicine, osteopathic medicine. He treated me 3 times the first week and twice the second week, and by the 3rd week I was walking. I wasn't ballet dancing, but I was walking. And I was so interested, I wanted to go into this field, which I did, starting in 1994, and I've been studying ever since to find better ways to bring people into their full potential health. One of the things that we have to pay attention to is all those medications that we are prescribed by all the many doctors that we see who maybe don't even know what the other one is doing. And the latest year statistics we have is 2010. And in 2010, deaths from FDA-approved drugs were 82,724. We get all excited when 18 people die from E. coli, from organic lettuce, but who's worrying about that? Serious outcomes, 471,291. Serious outcomes including death, hospitalization, life-threatening disability, and congenital anomalies. So there has to be other ways. And guess what? There are other ways. There are other ways to wellness. Acetaminophen, over-the-counter, non-steroidal anti-inflammatory, 7,500 deaths last year. There's something to be concerned about. So in looking at ways that we can overcome pain and illness without taking medications, I began to look at some of the common elements of living things. These are some leaves that I gathered yesterday, and you will see they have these veins that are branching. Even in these you can see branching. That seems to be a very common theme. Again, branching, branching. Here again, a central stalk branching. Why? So that all the nutrients can be distributed throughout the organism. Now the trees, of course, they branch above and then they branch below too. And inside our bodies, we have the same kind of situation. This is the nervous system. We see the branches. Here's the circulatory system. Now they always show the arteries on one side of the body and the veins on the other, but you know that they're both everywhere. And they branch even ever finer and finer. And this is the lymph system, which keeps, is important for the immune system. It distributes the infection-fighting organisms and eliminates those that the infection fighters have killed. So it's important to keep things moving. When things are blocked, whether it's information flowing over the nerves, blood, or the lymph, or any of the hormones in the body, when they're blocked or magnified or distorted, then we get the pain and the illness. So what happens with intractable pain is that the signals are sent up the spinal column to the brain. There are signals that are electrically sent. Now, when there's an electrical charge moving over bodies, such as a nerve fiber, it also has a magnetic field around it. So if there are enough nerve fibers going through a particular area, the magnetic field of that one is going to touch the magnetic field of one that hasn't yet started to fire off. So soon you have more nerve cells firing, and then the pain feels greater and greater. Then you go into the fight or flight mode. You go into sympathetic nervous system. So that's the cycle that must be broken. In the past, of course, they injected the anesthetic substances into the sympathetic nerves, the nerves that put us into that state. And they've also cut them. Not very good idea, because sometimes you need that. House might be on fire. Baby might be headed for the traffic. And it didn't work very well. There are other ways. One is craniosacral therapy. I do this on every patient. Craniosacral therapy deals with the cerebral spinal fluid as it moves through the brain and down the spinal column and back again. It moves with a particular rhythm. It's the first rhythm that happens as the baby is developing in the uterus, and it's the last one to leave at death. It's there after the heart stops beating. It's there after the breathing stops. It bathes all the nerves. If you've had illness, trauma, stress, that rhythm can change and become arrhythmic. The craniosacral therapist can sense that rhythm because there are membranes through the brain, and the membranes push on the cranial bones, and then you can feel it moving. And with craniosacral therapy, you can bring it back to its rhythm. And you can also calm that fight or flight instinct, because see where the craniosacral therapist's hands are palpating the vagus nerve. And the vagus nerve goes down to the internal organs such as stomach, heart, lungs, and so forth. Calm them, bring them back to normal. Here goes the vagus nerve. You can see it, heart, lungs, stomach, intestines. Now you're no longer in fight or flight, you're in feed and breathe mode. Now other cells communicate electrically. When you've had illness, when you've had stress and trauma, the electrical communication between now the cells is disturbed. Pulsed electromagnetic field therapy is another thing that I use often. It increases the flow of blood and oxygen to injured tissue, and that speeds healing. And at low intensities, it reduces inflammation, and a little bit higher, it decreases pain. And you also notice that I use acupuncture. You see the branching again. As you saw branching in the nervous system, in the circulatory system, and lymphatic system, there are energy channels within the body that also branch. There's 365 normal points, and 365 extra points, and 365 points on your ear. Each person's different in how those different points are affected. There are 12 meridians, 6 that come up from the feet to your legs and affect the organs such as liver, gallbladder, stomach, spleen, and kidneys. And 6 that go from the arm affect the heart, the lungs, the 3 cavities in the body, and the pericardium. And the way we can determine which points need to be treated, it's different for each person. We check pulses, and I can go into that if you have questions. There's 6 pulses, 3 on each arm, and we feel the different depths, the rate, strength, shape, and by the tongue. Then we know which points to treat, and we get to the heart of things. This is a system that's been infected, we know, at least 6,000 years. It's very effective. I often use craniosacral along with the pulse electromagnetic field therapy and this. And once the overexcited nervous system is calmed down and everything is flowing, that is blood, energy, and so forth from the acupuncture, then we can go into a gentle manipulation. There are external manipulations, such as with your spine, your joints, and you can also externally manipulate the viscera, calm, and so forth. Lymphatic pumping, again, you saw the branching in the lymphatic system. The pumping is important to keep the lymph and blood flowing, and it helps in healing. Herbs and nutritional support augment the treatments. Now, there's, the pulse electromagnetic therapy is something that I have been working with most recently. It's a modality that was approved in the United States for animals for years. It just in the last years been approved for humans. It's been used in Europe and in Canada. And it, again, increases the oxidation of the cells, so it helps them heal. There are some of the positive benefits. It speeds healing after surgery and repairs muscle, tendons, ligaments, soft tissues. I can give stories about how I've used it on people and animals. Repairs nerve damage, so it's useful for diabetic neuropathy, multiple sclerosis. I have Parkinson patients, post-polio. Also, well, many things that the nervous system affects. Any questions? Yes?
Why do elderly people faint or pass out when they go into the bathroom and their neck is turned down or something? A lot of elderly
people there are many different reasons, but a lot of it has to do with what's going on in the ear. So an otolaryngologist can test for that, put you on a table, you know, tilt you this way and that, and spin you around and see. It also could be a lack of proper blood flow to the brain.
Or something
yes,
like that?
Yep. Because the vagus response, particularly if your head is lowered and so on. Is that okay? Well, that just shows some of the membranes in the craniosacral that push on. This is a membrane that goes down the middle of the brain, the falx cerebri, and there are others that go through. They push on the cranium, and you can feel it. It takes a lot of practice, believe me. Okay. Here's how some nerves, you have pain nerves, and they recruit other nerves. This shows nerves going into the spinal column. Over these part are the nerves that are sending a message to the brain. Over this part are nerves coming from the brain to address pain. This is your sympathetic. And you see this little place right here. They're all going through the same little like passage. So if you're all trying to run through the corridor or get on the subway, you're going to get squeezed together. So the nerve going straight with the electrical conduction going down in the magnetic field around it on one of these is going to bump into the other one and stimulate it. Again, you see this common place. Not only that, but there's nerves on all of these veins, which will constrict. The nerves cause the vein to constrict. Now you've got more pain because of constriction. Here is again, you see, this is the spinal column. You have the nerves sending the messages up, and the nerves sending the message out, and the sympathetic nerves that will put you into a state of stress, and they're all together in there. And this is how pain magnifies. Okay?